do you think is the #1 issue facing Kentucky's public education system today?
Well, I'm not an expert in education. We have plenty of education experts here. But I know that not only in this state, but around the country, our youngsters in this, first and second grade test as well as any youngsters anywhere in the world. By the time we get to your age, we don't. So something is happening between the first grade and the 11th and 12th grades. And I'm not here to point the fingers at the parents or the teachers or anybody else, but clearly we've got to do it better. It's not a uniquely Kentucky problem. It's a national problem. Some would argue we have it a little worse than others, but I'm not here to give you my prescription for how to fill it. Most of these educational policies are determined in state government in Frankfurt, and the people who administer this program and the university could probably tell you more about it than I. All I can do is relate the results. And I already mentioned the math and science deficiency. Hopefully programs like this are beginning to address that deficiency.
I know several students in the academy are thinking about going into healthcare occupations, and so how will the new healthcare plan affect, as we pursue those careers and the careers we'll have?
Well, I was not a supporter of the new healthcare law. So it's hard for me to be very objective about it. I think it was the worst piece of legislation in the 25 years that I've been in the Senate, in a variety of different ways. Number one, it cut $500 billion out of Medicare over 10 years. Number two, it levied $500 billion in new health care taxes. And even if one could argue that requiring everybody to carry government prescribed health insurance was a good idea, it didn't address the need for healthcare providers such as you may be one day to meet those needs.